How do we avoid complications with interventional pain management? Well, one thing that we have to do is understand that there is evidence-based medicine. Evidence-based medicine is a foundation for everything that we do, hopefully in our respective practices. The problem is that with all the competing pain societies and with all the egos in interventional pain management, virtually only a small percentage of us ever follow guidelines. And so that's regrettable. It's regrettable because if we followed guidelines which have been created looking at evidence and looking at the literature, complications would likely be less than they are presently. But basically what we do is we look at the best available evidence, the clinical evidence which is out there, and we make certain recommendations for how we ought to guide our respective practices. Again, the problem is that as interventionalists, many of us have learned certain techniques and approaches, and we tend to like to stick to what works, at least for ourselves, without regard necessarily for practice guidelines. But if we followed our practice guidelines, then complications would be somewhat less.